Thank you very much for having me here in this news hours. Yes, the situation is really critical. I have just told by one friend of mine who was in Delhi, one of the big Delhi hospital, visited for some other purpose, not the COVID related. But when he reached there, the whole floor of the big hospitals was full of people. Not only the bed, even the receptions area, all this lobby, everybody, people are lying there to get support, the doctor's attentions to get treated. The situation is really critical. We as a Red Cross Red Crescent Society, with the largest network in the world, social network, and then we are really putting our efforts to, as an auxiliary to the government, to support the awareness campaign to the people, because the people slowly got tired of these restrictions on mobility, wearing mask and then hand washing and all that. That is what the second peak, this new variant really affecting India so fast. It is double, triple than the first wave in India. Okay. So we are promoting, we are advocating for the campaigning by the ambulance services through our national Indian Red Cross, and it is full filled with the oxygens, all this for the critical patients. That is also has there are limitations, but we are supporting government of India is really intensify to produce more oxygens, setting up the new plant in different cities. So probably, hopefully, within a week time, the oxygen supply will come under control. That's the one reasons even the Prime Minister of India holding a meeting with all the state chief ministers, how to control this scarcity of the oxygen, how we produce the oxygen. And Red Cross is supporting them. The oxygen we have, we will definitely provide to the hospitals, and then those critical patients who are seeking for the ambulance service with the oxygen cylinders available. That is how we are providing support. Our priority is to keep the people's informing, the calming down, and then helping government efforts to get the more and more health support in the remote area as well as in the urban area, and then provide awareness, making awareness, mobilizing our volunteers, keep the social distancings, and then, as far as possible, to provide the oxygens to the people in need.
Yes, means, but if I will tell you the true reality, if you talk about in the January, like the starting of January or the mid of January, means I am posted in a COVID ward since last 1 year. And in the mid of January, we have only one patient left of COVID patient. So there is definitely a downfall to the COVID patient load. That is true. But the thing is that after that, and there is no measures taken to stop that virus at that level. Like even the vaccine program was promoted as not as a preventive measure, but as in a treatment sort of thing. Like if now a vaccine came, now no one will get infected. So these type of strategies was taken by the government, which has resulted into like a laxity by the public also, and there is definitely an ignorant behavior by the government, which has resulted into a second wave. Now the second wave is resulting much more destruction than the previous one. There is much more focus on the mutant strains, and now we are our government is also focusing on that strains. But the issue is that there is no active measures was taken to break the chain of transmission, or to to promote mask and other things by the government. And we have seen that even our policy makers, our government, our ministers, they are more involved into the election rallies and other things